Hello, Dr. James Bogash, expert in health and longevity, and as a practicing chiropractor. This updated review by the American Academy of Neurology certainly strikes home. And it has everything to do with epidural steroid injections, spinal injections, whatever you want to call it. Some people don't realize that they almost will always use a steroid injection. There's other things that can be used, but typically, if insurance is going to be paying for it, there's going to be some steroid added into that. So the last guidelines put out were in 2007, and back then the data was not really that stellar for epidurals, and so the updated guidelines haven't really changed all that much. But before I tell you when epidurals are definitely going to be a good idea and when they're not, make sure you like this video, share it with somebody you think needs the information, and subscribe to the channel. So before we get into that, we need to differentiate two different things. And one is axial or back pain, and the other one is radicular pain or pain down into the leg. Now, all the time I have patients come in and they tell me they have sciatica and they point to their back or their shoulder or their neck or their arm. When we have radicular pain into the leg, it is caused by either the physical bulge of the disc or a chemical irritation that happens to be in the area from the disc bulge, and then that the nerve is sitting in a soup of inflammation. And when somebody comes in, because I hear it all the time that people say they have sciatica. Quite frankly, it's really not as common as most people think. And somebody comes into my office and they have leg pain, and we literally in one visit it's gone. That was not sciatica. What do I look for? What do I have discussions with the patient? First of all, patterns. There's something called the dermatomal pattern, that if it's a nerve that's involved, it's going to be in a very specific pattern. Generally goes down to the foot and in specific toes, or if we're looking at the arms, it's specific fingers. These fingers, traditional finger, this finger, these fingers. There's a distinct pattern that sciatic or radicular pain from the neck is consistent with. Things that aggravate it with generally like nerve root tension signs. When we're dealing with this, nerves don't like to be stretched. So if it's pinched somewhere, or there's the disc bulge of there, and it starts to pull on the nerve, you're not going to be very happy when that happens. And so there are nerve root tension signs that you would look for, both in the arm and in the leg. For me, when somebody comes in and they've got their hand on the head, it's called Picotti sign. It's the first sign that they're trying to take pressure off that nerve root from stretching. And that can be the first warning sign that maybe we're dealing with some disc irritation. Now, and generally those symptoms are worse at night, because when we're during the day, there's pressure on those discs and they push some of the fluid out and they're actually smaller. When you lie down at night, they start to swell, and if they're going to be pressing on something, it's going to get worse as those discs swell. So when are these? Because I've seen all kinds of cases. I've seen where epidurals were absolutely not going to work, and patients were given tens of thousands of dollars of injections with very little benefit. On the other hand, we've referred patients who are very good candidates for epidurals that do really well. So chiropractors generally have a tendency to be very good gatekeepers for this, because we know we more likely understand what's going to respond and what's not. The challenge is that if you're giving these epidurals, like those steroids have long-term consequences. Even a single injection of steroids will permanently change the health of the soft tissues. And Lord knows there's lots of people have had steroid injections, 2, 3, 4, 10 times over the course of their life, and those are all cumulative. The other thing is that epidurals almost double your risk of ultimately having surgery. It's probably more to do with what you're willing to accept than it is the epidural actually doing something, but there is a definite association between having epidurals and having later surgery. So what do we know, and what did this review look at? And it looked at axial back pain, and it looked at radicular back pain. In general, if somebody has axial pain, the benefits are really not that strong, and if they are, they're very short-lived. If somebody has radicular pain, it is going to have a better benefit, albeit it's still a short-term benefit. When we refer patients out for epidurals, we let them know that this is just one tool, and it allows a window by which we can do more and get them feeling better while they're not suffering as much in the time frame. So somebody comes in and they've got raging radicular pain down into the arm, and in 3 months that's going to be better, and really in our office it usually starts feeling better within a week or two. The conversation I always have with patients is the epidural will speed that along. So if somebody's got a really good pain tolerance and they really don't want steroids, then it's just going to be time, more likely. If they just want to get comfortable again, the epidural, that's a perfect scenario to use that. Same thing into the leg. For stenosis, so an advanced degenerative condition where the opening the data on epidurals is really pretty weak. And that's not anything new. We've known that for a long time. So the bottom line is you should always seek conservative care first. Your first stop should not be pain management or orthopedic. And if your primary care doctor is sending you right off to pain management or orthopedic, it's not the trajectory that we have seen to produce better outcomes, both cost and outcomes and patient satisfaction. So if you've got pain down into a limb and it fits these patterns where it's truly radicular, then an epidural can speed up or make you more comfortable as that scenario heals itself. And if we're dealing with a chemical radiculitis where that inflamed nerve root is sitting in a soup of inflammation, then it makes sense that putting in a steroid in there is going to have a pretty profound impact that arguably is closer to a fix than anything else. So, as always, I will post a link to this particular study in the description. Make sure you like this video, share it with somebody you think needs the information, and subscribe to the channel.